Why do you keep calling this the Chinese virus? There are reports of dozens of incidents of bias against Chinese Americans in this country. Why do you keep using this? A lot of people say it's racist.
It's not racist at all, no, not at all. It comes from China.
A number of factors have led to the rise of anti-Asian hate during this pandemic. One is obviously the inflammatory political statements of certain politicians during this time period.
President Trump's blaming of China, his refusal to wholeheartedly disavow hate groups, and his encouragement of violence through rhetoric at his rallies and online have led to dangerous splitting and othering.
In 2020 alone, it was reported that nearly 2,800 hate incidents were committed against Asian Americans.
Scapegoating causes injury, conflict, and grief. The elderly Thai American man in Oakland who was shoved and killed in his driveway did not deserve to die. The Burmese American family shopping in Texas did not deserve to be attacked. And the 2-year-old child did not deserve to have his face slashed. I can go on and on. Nothing is solved by harming the innocent.
Regarding being a direct target of racial discrimination, this has tremendous insidious effects as well as toxic effects on individuals and communities that are targeted.
Hatred is toxic to well-being. Being targeted by discrimination and power imbalances directly impacts perceived safety and belonging, which impact mental health.
Actual fear of the possibility, even worse, actual experience of being threatened, attacked, cause negative physical and emotional reactions.
When an individual is victimized by hate activity, it can lead to post-traumatic stress disorder, anxiety, panic attacks, nightmares, and depression.
Research shows that the experience of discrimination, whether through institutional barriers or interpersonal interactions, such as racial slurs used by one individual against another, impacts health by operating as an ongoing stressor, causing progressive wear and tear on the body, which ultimately results in worse health outcomes.
In addition, these separate instances can reactivate prior instances of racial trauma in vulnerable populations, ultimately having a compounding effect.
Asian American parents have been more reluctant to allow their children to return to in-person schooling because of fears of racism, potentially leading to mental health impacts.
Some estimates are that 1 in 4 Asian American students has been bullied or victimized by anti-Asian sentiment during the pandemic. So no wonder the Department of Education has found that Asian American students are the most likely among all ethnicities to not return to school for in-person learning.
Recent research also suggests that discrimination may affect people through less direct means, such as avoidance of healthcare appointments or checkups. To address this head-on, we need bilingual therapists, caseworkers, and outreach workers who approach their potential patients where they live, where they work, and where they conduct their business and daily activities. We need to teach them to identify, practice, and address microaggressions at the time that they occur.
Please talk with each of your patients that either spontaneously share with you their concerns or may have known that they've had these concerns in the past in an open-ended, culturally humble, and curious way, asking them how they're doing and how the impact of these current events may be affecting them.
The APA newspaper, Psychiatric News, published a special report called Asian American Hate Incidents, a co-occurring epidemic during COVID-19. I'd refer psychiatrists and therapists to this publication for tips on counseling victims of anti-Asian hate. I'd also encourage reporting incidents to stopaapihate.org. It's an online reporting site run by Asian American advocacy organizations in San Francisco.
All mental health is cultural mental health, from neurons to neighborhoods to the world itself. As psychiatrists, I hope we can amplify our understandings of the social determinants of mental health and begin to understand the individual is not separate from their relationships or society. We are who happens to us and what we make of the happening, and we are all happening to each other. I hope we can make the best of this.
The drive towards equity and equality begins with really active listening, and I think in the APA we are in that stage of the solution.
We can work together as BIPOC communities in solidarity to dismantle structures of oppression, including structural racism in our country.
Moving forward, now is a historical and galvanizing moment and an opportune time for us to unite together to form solidarity, coalition, to advance equity and fight against any forms of discrimination, intolerance, prejudice, and systemic injustice for all Americans.